Okay, John, you're live.
All right. Hello and welcome to our 7th regional report out. Today is January 26th, and we'll be here at 3:30 next week also to give you your report out from the Northwest region. We have a smaller group with us today. Our two folks that have been helping us with from the public health side are both giving out vaccines today, and that's exactly where we want them to be. But I will go through the dashboard and then we'll kick it over to Reagan to hear a little bit about what's going on from the hospital side. We'll hear from Dr. Watson on transfers, and if she's able to, the now chief advisor for COVID-19 coordination for the governor will be joining us, Dr. Marcy Nielsen, and she's been a real value add to just talk about the vaccine process. So let me go on over to the dashboard here to kick us off. All right. Okay, so looking at the Northwest region here, one thing I do want to just point out and let people know is when you look at the staff shortages, this has been something we focused on and has been getting better. And you see that there's zero showing up as 0%. The important thing to recognize, and we've been asked to clarify this, is it says critical staffing shortages. And there were really some critical moments. And this doesn't mean that there's still not some staffing shortages, or also that we're asking a lot, particularly of our nurses, to carry a heavier load than what they're used to carrying right now. So I just want to make sure everybody knew that this doesn't mean from a staffing standpoint we're out of the woods or everything's great. It just means we're at least not in the critical position that we have been in some of the past weeks. So when looking at the numbers here, I like to been wanting to go back and looking at it at a couple week flow just so you can get a sense of what's going on. So when you look at confirmed or suspected COVID hospitalized patients in the Northwest region, we're at 52. 2 weeks ago, we were at 58. Last week, we're at 48. So we're kind of hovering in this area. Same on the COVID ICU patients, 7 each of the past 2 weeks, 6 this week. And then coming over to adult staffed ICU beds available, that is also hovering right now. 13 2 weeks ago, 14, 12 this week, and that gives us 50%. So these numbers are looking static over the last couple of weeks. A number that's looking even a little better here all the time. So we had this peak in late November and early December, and we've now in Northwest Kansas been able to bring that down to 195, which is the lowest it's been in a very long time. New cases this past week. And I'll also slide over here. This is the KDHE's positivity rate by region. And when you look at the Northwest here, ignore this is the tests as they're coming on right now this next week. But looking at this week that we're in right now for the Northwest region, so you have 7.68%. You have to go back all the way to looks like July before you see that low, or August, sorry, before you see that low of a number before. So that's a really good sign. That's the positivity rate. That's the percent of people taking tests. Wait, did I get off kilter there? No, I didn't. Okay. Yep. And so that's a good sign that this region is moving in the right direction also. So that's good. A good positive story for the Northwest region. It means that the mitigation efforts have been working, and we've really slowed the spread up here. But let me pass it over to Reagan to give us an update really from what's going on from the hospital side of things here in the Northwest region.
Good afternoon, everybody. Reagan Cusimano, Director of Governmental Affairs for the University of Kansas Health System. I am happy to report last week our numbers were around 17 in the Hayes health system out there. We are down to 14, so we're down 3 patients, which may not seem like much to everyone else, but it is a good number for us. We continue to have 2 patients at Great Bend, and we did have 1 patient in Pawnee Valley at the last report, and we currently have 0 COVID patients at Pawnee Valley and Larned. So we are seeing a slow decrease around our inpatient COVID population. And just to kind of piggyback a little bit on John's communication around nursing shortages, I think one of the things that we're seeing as a system, we're hoping as the vaccine has rolled out and as minds have shifted, we are starting to see a lower number of staff who are out due to COVID. So that is also a good thing for us to see while we are kind of waiting for the rest of the month to finish off to see where we are moving forward.
Thank you, Reagan.
Thank you.
Well, let's pass it over to Dr. Watson here. I'll make you the presenter. You can talk to us a little bit about the transfer situation.
Well, great, and thanks. We'll show you what we're looking at, and I think it's just what Reagan was talking about. The statewide, we've seen capacity ease back toward where we're at normal levels for this time of year. We still see Wichita as a bottleneck. There is some bottleneck up in the northeast part of the state, but the Northwest is really, the numbers are coming down. I think it's interesting, John, when you look at the peak and the number of cases per month that we had at the peak, and then you look at the current numbers and you see what's the percentage off the peak that we are, you start to realize once you get below that 50% of the peak number, then you really have an easing in the system. And so interesting to see where we are here. I think for the statistics, about the same. We're seeing about 25% COVID suspected. We're getting about 30% of the people asking to have assistance finding beds, and the transfer times really are evening out. We're around an hour for non-COVIDs. We're a little bit below 2 hours for the COVID patients, and I think overall it bodes really well for the system. I enjoyed a comment from an earlier call that said, concerned about Chiefs watch parties. I hadn't really thought of post Super Bowl as being another potential moment, but maybe we should be talking about that in light of people think the vaccine's out there and we're all past everything, that suddenly there'll be gatherings for the Super Bowl. But please ignore that thought of getting together and trying to do your best to continue as we are, and go Chiefs, but stop the virus here.
That's good, Dr. Watson. Thank you for that. So it looks like Marcy may still be in that meeting with the governor. So I'm going to give a little bit of an update on the vaccine from what we've heard on earlier calls. So, when you look here, this is kansasvaccine.gov. Kansasvaccine.gov. You'll remember vaccine has 2 C's. So we showed this. Oh, Marcy's going to make it in here. Okay. So we showed this last week, and they've really retooled a little bit. I like it even better. So you can see a number of people in the state vaccinated by first and second dose, total doses distributed into the state. And last week, this number was 3.5% of the state's population had been vaccinated. Now 4.5%. You can see vaccines, who's gotten it by age group, by manufacturer, Pfizer and Moderna, by gender, and then first and second doses by day here also. So some really good charts. I found this one to be particularly helpful. It's a new one on here, and this is the number of doses distributed by county for the week of January 25th. So every week they're updating, what's been going out. So you'll see Ellis County here with 300, Russell at 100. And so it's a nice place to come look and see the stats and see what's coming in. Now, what's interesting about this is, speaking from a Kansas perspective, we have somewhere between, I've heard around 800,000 to 1 million people in phase 2, or combined, I think it's 1 million combined phase 1 and 2. and we got 45,000 doses last week from the federal government. So that's going to take a while, even if we're able to significantly increase the amount coming in. And so just encouraging people to be patient as that rolls in, and as your local health department tries to get those doses out. Now, I'll remind you too to pay attention to your local health departments, to be hearing what their strategy is on the way they're working through phase 2, whether they have a waiting list or not. They've been encouraging us to check your county health department's website or Facebook page first before ringing them. But if you can't find the answers you need, go ahead and give them a call. And then we've heard, in some of the counties, just good cooperation between the hospitals and the health departments. With us, and I'll pivot over to, is Dr. Marcy Nielsen, as I mentioned earlier, in her first full-time week here as Chief Advisor of COVID-19 Coordination in the state of Kansas for the governor, and is leaning in to make sure communication and coordination are as good as they can be as we try and get this vaccine out. And we've just asked Dr. Nielsen to come give us an update on what's going on and what she's seeing so far. And you're muted. Yep, there we go.
Thank you, John. And thank you for inviting me, for hosting these meetings. Your commitment to getting the word out on what's happening on the ground and giving us an opportunity to share that information is incredibly helpful, as I think everyone recognizes the situation that we are in is unprecedented, and we are sadly behind other countries when it comes to being able to get the vaccine roll out quickly. That's for lots of different reasons, and making excuses is not what people are interested in hearing. They're interested in hearing what it is we're going to do moving forward to increase the amount of information and to increase the visibility. I think the data piece that you were sharing, the KDHE new website with the dashboard, will be continuing to add more information there. But I think what we are expecting from the federal government over the course of the next few weeks / months is both a more centralized way in which to get vaccine out to states, more information to individuals. Vaccinefinder.gov will be a way for individuals to get signed up and have access at a national level to all of the various ways in which different providers are going to be offering vaccine. That doesn't yet exist. We're expecting that to be up and running in mid-February. So the state, as we wait for the feds to kind of catch up with this work, the state is going to be sharing a map that helps Kansans navigate to those providers who have vaccine, who are interested in offering vaccine. I empathize with how frustrated people are because they just don't have answers. I think Kansans recognize that we need to be patient. To your point, if we've got 1 million people in phase 2, but we have been on average just getting 45,000 doses a week, obviously it's going to take us a little while to get through phase 1, and we're hoping to be able to get more vaccine. That's really been the rate limiting factor. It's a shortage, and we're trying to prioritize those who need the vaccine most.
Thank you very much. Yeah, definitely higher demand than there is supply right now. So when you think of a supply demand curve, that's where the problem is. I know the federal government's trying to work on that, and as they can benefit and get more to the state, sounds like people are ready. Now, hey, we heard on, I can't remember his last call or call before that, I think it was the last call, that people are heard our Secretary of Health say, hey, you can go in any county and get it. And so they are signing up in every county that has a sign-up list, no matter where they live. And I don't think that was the intention of what he meant, but I wanted to give you an opportunity to clarify that also.
Yeah. Really, we're anticipating that most people here do the right thing. So if you're somebody who is going to try to game the system, most local public health departments or providers are going to look at that list and say, well, this person isn't from our county, and we're limiting who we provide vaccines to. We didn't want to be overly prescriptive to local public health departments and counties. I mean, ultimately, they have the say within the state guidelines. But to your point, John, we absolutely don't encourage people to try to game the system. This works on the honor system, and we don't want to put healthcare providers in a position to have to be policemen.
Yeah, and I think the spirit of what he was saying was, you live in one county and work in another, or vice versa. That it's not an issue. The state
right.
largely is going to be trying to move through the phases, around the same time, as my understanding. They're just prioritizing differently inside of each phase. But we know people are very anxious to get this vaccine and to move forward with it. Reagan or Dr. Watson, do you guys have any questions for Dr. Nielsen, or any clarifications that you'd like to hear?
I would just I think it's a great opportunity. Marcy has probably had this question many times, and it's something that I know we have spoken a lot about in the legislature and different committees, just around how the vaccine is allocated and how it's allocated to us as a state as a percentage, and then how it's allocated to different communities on a per capita basis. I think that is helpful for people to understand and to know.
Yeah, and it's a question we have been hearing a lot. So first of all, Kansas is a small state, about 1% of the population, and the feds are giving us vaccine based on our population. So we are capped at how much vaccine we've been getting. In phase one, when we were making those allocation decisions, we worked with the Kansas Hospital Association, with the local public health departments, et cetera, to do an estimate of all the number of healthcare providers we had in Kansas, as well as the number of folks who lived in long-term care facilities. So that was pretty easy to estimate, and some counties received more vaccine as a result of that than others. Where things start to get complicated is now that we're in phase two, and you've got more broad categories. So over the age of 65, folks who live in congregate settings, and folks who work in what we call high contact critical jobs. Those individuals obviously live all over the state. We think there are about 1 million of them. How do you allocate fairly, taking into account population, taking into account the number of providers who have capacity, where ultra cold storage is? So we put together what is an allocation mathematical equation. It's an algorithm, and that algorithm takes all of these variables into account, makes sort of recommendations on where those individuals are within that phase, and then we do a gut check. Does this look right? Does this feel right? Last week was our first week to use that formula, and it seems to be matching up with what our expectations are. As we get more vaccine, and we are anticipating the feds to bump up bump up the number of vaccines we're going to be receiving. It's not only important to know how we're allocating, but also how many weeks out we are getting that vaccine, so that providers can make plans. They want to know. It's not that they are unwilling to be patient. They just need to be able to make plans. So how are decisions being made about allocations, and for how long? And we're receiving some indications that we're going to have more than a 1 week window. Did Reagan, did you have additional questions on that allocation?
No, I just think that that's something that we heard a lot about today in one of our committee hearings was a lot of confusion just around phase one and how it was rolled out and why it was so much easier, which you just explained, because it was going to a very set number of constituents, whereas phase two has just been a little bit harder to judge. And we're trying our best to figure out where everything should go and how they're allocated on the per capita basis.
Yeah, and those variables that fit into that formula, we're trying to be cognizant of course, population, but also social vulnerability. We know that communities of color aren't getting vaccine, and this is across the United States in the numbers that they need to. So we try to account for that within the model. It sounds like, Reagan, we need to do a better job of getting that information out. And Reagan and I used to work together, so she knows what a nerd I am. I actually wrote a 2-page document on exactly how the allocation works because I wanted to know, right? It's important. You want to know that the vaccine is being allocated fairly.
That's great, Dr. Nielsen. I appreciate it. Anybody else have any comments or questions before we wrap this call up? Well, I appreciate everybody. Dr. Nielsen, we appreciate all the work you're doing and how important it is across the state, and always want to be helpful to you in that. Reagan and Dr. Watson, thank you. We like to end with a bright spot. I got 2 of them here. One from Pratt, Kansas. 2 donors pitched in $95,000 and were able to pay off 430 families' medical bills this past week, which is, made a big difference in a lot of people's lives. And then on another call, we had a friend from Eureka who was telling us about a patient that had fallen down and broken her hip and was in the hospital, their Greenwood County Hospital there, and mentioned to their nurse that they had a pet at home that they were worried about. And so that nurse went, got the keys from the patient, picked up their dog, and is boarding the dog at their house while the patient recovers. Just great moments of human kindness and generosity that should inspire all of us in these kind of times. So I'm going to go through a rash of websites for you too, just so you can remember where to go get information. covid.ks.gov/report-outs is our website. You can sign up to get this call and dashboards. If you have questions for us, ksregionalreport@gmail.com, and we'll try and address them on the next call. If you're looking to get tested, go gettested.com/Kansas to find a free testing site. And kansasvaccine.gov, which we showed you earlier, will have information about the vaccine. So as you heard, Northwest Kansas numbers are getting better. Don't let up. Stay strong, and hopefully we can continue to move forward on our way out of this pandemic. All right, everybody, thank you very much for your time, and we'll see you this time next week, 3:30.